EMT practice test questions and answers with explanation. 25 fundamental questions. Question 1. What is the standard ratio of compressions to breaths in single rescuer adult CPR? 15:2, 30:2, 5:1, 10:1. 30 compressions to 2 breaths is the adult standard. Question 2. Which of the following is a normal resting heart rate for an adult? 40 bpm, 72 bpm, 130 bpm, 180 bpm. The normal range is 60 to 100 bpm. Question 3. What is the B in the ABCs of emergency care? Blood pressure, breathing, bleeding, body temperature. Airway, breathing, circulation. Question 4. A patient is found unresponsive and not breathing. What is your first action? Call for help/check for a pulse. Start rescue breathing. Give aspirin. Check blood pressure. Initial BLS assessment for unresponsiveness starts with help and a pulse check. Question 5. What does a pulse oximeter measure? Blood pressure, oxygen saturation of hemoglobin, carbon dioxide levels, blood sugar. It provides the SpO2 percentage. Question 6. Which of the following is a sign of an airway obstruction? Talking clearly, stridor or inability to speak, sneezing, normal chest rise. Inability to speak or move air indicates a blockage. Question 7. What is the primary treatment for a patient with severe heat stroke? Give them a hot drink. Rapid cooling, example, cold packs, water. Make them exercise. Give them a heavy blanket. Heat stroke is a medical emergency requiring rapid cooling. Question 8. In APRST, what does the P stand for? Pain, provocation/palliation, pulse, position. It asks what makes the pain better or worse. Question 9. Where should you check a pulse on an unresponsive adult? Radial artery, carotid artery, brachial artery, femoral artery. The carotid is the most reliable central pulse in an adult. Question 10. What is the name of the bone in the upper arm? Radius, ulna, humerus, femur. The humerus connects the shoulder to the elbow. Question 11. A patient who is cyanotic has skin that is red, yellow, blue/gray, white. Cyanosis indicates a lack of oxygen in the blood. Question 12. What is the purpose of this secondary assessment? To find life threats. To perform a head-to-toe physical exam and find non-life-threatening injuries. To decide which hospital to go to. To fill out insurance paperwork. Primary finds life threats, secondary finds everything else. Question 13. A patient is tachypneic. This means their breathing is too slow, too fast, irregular, stopped. Tachy, fast, plus pnea, breathing. Question 14. What should you do first for an open wound with severe bleeding? Apply a tourniquet. Apply direct pressure. Elevate the limb. Apply an antibiotic. Direct pressure is the first step. Tourniquets are for uncontrolled bleeding. Question 15. Which of the following is an upper airway structure? Alveoli, bronchi, pharynx, diaphragm. The pharynx is part of the upper airway, others are lower. Question 16. What is the rule of nines used for? Stroke assessment, burn surface area estimation, GCS scoring, medication dosage. It divides the body into sections of 9% to estimate burn size. Question 17. A patient with hypotension has high blood pressure, low blood sugar, slow heart rate. Hypo, low, plus tension, pressure. Question 18. What is the correct treatment for a suspected fractured arm? Force the bone back into place. Splint the arm in the position found. Let the patient swing the arm. Apply a hot compress. Splinting prevents further injury and reduces pain. Question 19. What is the most common cause of airway obstruction in an unresponsive patient? The tongue, a piece of food, blood, vomit. In unresponsiveness, the tongue often falls back and blocks the airway. Question 20. How should you move a patient with a suspected spinal injury? Walk them to the ambulance. Drag them by the feet. Log roll and secure to a backboard. Carry them in a chair. Maintaining spinal alignment is critical.